Welcome back to the Med Madness podcast, where we delve into the depths of medical knowledge to prepare you for the USMLE and beyond. Today, we're exploring a critical aspect of obstetrics, the normal progression of labour. We'll break down the stages, discuss the evaluation and management strategies, and conclude with a real-life case study to solidify our understanding. Next, let's discuss the transformative journey of labour. Labour begins with the onset of regular contractions and culminates in the birth of a baby. The first stage of labour is particularly significant as it spans from the onset of these contractions to the full dilation of the cervix, which is 10 centimetres. This stage is divided into two distinct phases, the latent phase and the active phase. Now, moving on to the latent phase, which marks the early part of labour. During this phase, the cervix dilates slowly, moving from 0 to 6 centimetres. This phase can vary greatly in duration, typically lasting up to 20 hours for first-time mothers, known as nulliparous women, and up to 14 hours for those who have given birth before, referred to as multiparous women. Despite its often prolonged nature, this phase is crucial as it prepares the cervix for the more rapid changes to come. Transitioning into the active phase signifies a shift towards more rapid cervical dilation. Here, the cervix dilates from 6 centimetres to full dilation at 10 centimetres. The expected rate of dilation in this phase is at least 1 centimetre every 2 hours. On average, this phase lasts about 4.9 hours for first-time mothers and 3.5 hours for those who have previously given birth. Next, let's talk about evaluating labour progression. Monitoring labour progression involves evaluating several key parameters. In the latent phase, a dilation rate of about 3 centimetres over 6 hours is typical. As labour advances into the active phase, a dilation rate of 1 centimetre per hour is consistent with normal progression. Alongside cervical dilation, the fetal station, a measure of the baby's descent through the pelvis, should show steady progress. For example, moving from -2 to +1 station as the cervix dilates from 6 to 8 centimetres indicates normal progression. Another essential tool in evaluating labour is the labour curve. The labour curve is a valuable tool for visualising labour progression. This graph plots cervical dilation against the time elapsed since admission, helping healthcare providers assess whether labour is progressing normally. A key indicator of normal active phase labour is a cervical dilation rate of at least 1 centimetre every 2 hours, accompanied by a corresponding descent of the fetal head. Management strategies during labour depend heavily on the rate of cervical change and overall maternal fetal status. For women experiencing normal labour progression, expectant management is the best approach. This involves regular monitoring to ensure both the mother and baby are doing well. If labour stalls and there is no cervical change for 4 hours despite adequate contractions, or for 6 hours with inadequate contractions, a caesarean delivery is indicated. When cervical dilation slows to less than 1 centimetre per 2 hours, the strength and frequency of contractions are assessed using an intrauterine pressure catheter. If contractions are inadequate, labour can be augmented with oxytocin to increase their frequency and force. During the second stage of labour, from full dilation to the delivery of the baby, if there are Category 3 fetal heart rate tracings, or if the mother is exhausted, an operative vaginal delivery using tools like forceps may be necessary. To illustrate, let's consider a real-life case. A 28-year-old nulliparous woman was admitted to the labour ward with regular contractions. Initially, she was in the latent phase, and over 6 hours her cervix dilated from 3 to 6 centimetres, a rate consistent with normal progression. As she transitioned into the active phase, her cervix continued to dilate at a rate of 1 centimetre per hour, reaching 8 centimetres after 2 hours. The fetal station also progressed from -2 to +1, indicating a healthy descent. With stable vital signs and a reassuring Category Y fetal heart rate tracing, the healthcare team continued, with expectant management leading to a successful and uncomplicated delivery. Understanding the nuances of labour progression is vital for ensuring both maternal and fetal well-being. By closely monitoring cervical dilation and fetal station, healthcare providers can make informed decisions to support a safe and effective labour process. Thank you for joining us on this episode of Med Madness. Stay tuned for more insights and discussions on key medical topics. Until next time, keep learning and stay curious.